As schools have closed due to COVID-19, students lost access to many resources available to them, including counselors and therapists. Alexa Mignano, director of school-based clinical services at River Valley Counseling Center, spoke with Connecting Point's Zydalis Bauer about how they had to quickly adjust their approach in meeting with students and how this pandemic has affected mental health of young people.
So I'm the director of school-based clinical services, and we've been providing school-based therapy for children in districts across Hampshire and Hampton counties. We are in 10 school districts currently. We have about 60 therapists that go out and service children in their schools. And one of the reasons that we do this is because it really reduces the barriers that children and adolescents have to accessing therapy. So, things like schedules and insurance and long wait lists are barriers that a lot of families face. So by going to the schools, we strip those away and we provide greater access for kids.
Now, what has had to change during this health crisis due to COVID-19 with how you interact with those students in the therapy sessions?
Right. So we are usually very active in therapy sessions with kids. There's a lot of play. There's doll houses and sand tray work and a lot of physical activities that we do with kids. So all of our therapists have had to shift to doing telehealth with their kids. And so we've had to get really creative and learn on the spot with this. But our therapists are doing a great job. We have a lot of interactive activities that they do with the kids on screen, a lot of screen sharing activities. We do fun things with them in a different way. We're all sort of getting used to this and adjusting.
And I know that young people sometimes have that reputation that they're always on their phone or they love technology.
Mm-hmm.
But I can imagine that even people who are used to technology, this is still a difficult situation. So what are you hearing from them? How much difficulty are these students having adjusting to this?
There's no doubt that kids rather in-person interactions with their therapists, with their teachers. I think even a lot of kids that didn't really like school before are realizing actually school was pretty great and I really miss it. So I think kids are struggling a little bit with being online all day. If they're doing a lot of schoolwork on the computer and then they're also engaging with their friends online, there's a lot of screen time happening, which is not generally good for kids to be in front of a screen all day.
What has been the response from the students to the telehealth with their counselors?
Right away, we had about 50% of kids jump online and give it a try. And I think we've all been pleasantly surprised that we can really actually maintain pretty good connection, through video. And then as the weeks went by, we had more and more kids jump on board. Kids and families that I think were hesitant about it have been happy with the service. And again, I think that has a lot to do with how our clinicians are trying to keep these sessions really interactive for kids to be able to sit there. One of the benefits is that kids who maybe found school to be very stressful in the past no longer have that specific stressor, and so they're really able to engage with their therapist around underlying issues of anxiety and social skills. We've found that families are more involved in therapy now that we're in their homes. So parents will drop in the beginning of sessions or at the end. Siblings will join in for problem-solving issues that are happening at home. So that's been a really nice benefit of doing it this way.
And speaking of maintaining that contact, why is it so important to keep that schedule with these students?
I think it's easy, I think, for parents to say, well, the stressor isn't there of school. They don't really need the support right now. And so I think that goes back to there's underlying issues why school was difficult for them. And this is a perfect time for us to really access them emotionally and work on some of these things. And it's also really important for the relationship between the therapist and the child. That's really what makes therapy work. First and foremost is that there's a good connection. So even if you can't fit therapy in weekly, I think it's really helpful to at least get it in some way, either bi-weekly or another option. The other piece of this is that, kids really thrive on some sort of routine. And so if they know that they're going to see their therapist every week, that's part of their routine, it's part of their check-in. It really helps to reduce overall anxiety when a lot of this is out of their control.
Now, many of us are going through that anxiety and the uncertainty. So do you have some tips, especially for parents with young students that are going through this struggle with not being in school, not seeing their friends? What can they do to calm themselves and make themselves feel a little bit better about what's happening?
Kids, if you leave too much information out, kids will fill in the blanks, usually with something that's pretty catastrophic. So it is helpful to share some information with your kids in a developmentally appropriate way. Give them the information you have. Let them know the facts that you know. A lot of kids are wondering what is going to happen in the fall. We don't know exactly what's going to happen in the fall, and it's okay to say that as soon as we know, we will let you know. The facts are there's going to be a summer of some sort, and then you're going to start school again in some way. And what that looks like, we'll get there. I think right now, parents need to try to establish some type of routine for their kids if they haven't done so already. Beginnings and endings to activities help to reduce anxiety because there is a greater sense of control. Try to organize the day a little bit. I tell families to start with a morning meeting. One of the things that schools do so well is they start with some sort of circle time for younger kids, or they have homeroom for the older kids. And so they set up this predictable schedule with the kids every single morning. So if we can mimic that a little bit at home, every kid has a checklist of what they need to do for the day. Maybe there's some expectations around when screen time's okay and when it's not. But sort of managing the uncertainty by inputting some routine and schedule. And then, it sounds very basic, but I know everyone keeps saying it, you've got to work in some movement. Movement for kids, they should be getting an hour a day of physical activity, and adults too. We have to take care of ourselves. So a simple walk can really make a difference.
Now, on top of all the telehealth support that you've been offering students and families, I know some lucky students received a nice little gift from you. Can you tell us a little bit about that?
They did. So we have a lovely program that's happening in Holyoke right now with Peck and Veritas schools, and it's called the WISE program. And so 18 families that were part of that program received calm down or comfort packages that included a variety of things such as materials to make glitter bottles for calming down, or stress balls. They received some art supplies and some different tips for getting through some of the anxiety that can occur during this time. So it really encouraged some family involvement. They got on a Google Hangout call together and discussed how they were using the materials and how to be strong and get through all of this.
You have all done a great job at kind of working fast to get this up and running. The school closures were announced so quickly.
Yes.
How has it been for you to provide this service and that adjustment that you've had to make?
We're used to that in-person energy with kids, and having to shift has been certainly tiring to make sure these sessions are going well. But I think we remain hopeful. I think that the kids are getting really good service. We as a River Valley group have a database of lots of activities and things that we're pulling from to make sure that we're keeping things going for kids, and also taking care of ourselves. We have regular staff meetings and supervision meetings, and doing things, practicing what we preach, sort of thing, making sure we're getting that self-care in as well.